professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And this recording, this clip is about understanding a little bit more about syndemics. So before I get into the concept and terminology of syndemic, let me tell you where I got this article from. This is actually an article that was forwarded to me by a colleague, Dr. Sandra Bever, and she provided an anthropological perspective, which was something that provided a kind of a different approach to understanding COVID-19 pandemic. For starters, but also the idea of structural violence, which is a unique anthropological insight rather than public health, medical, or nursing. So the concept of syndemics, as opposed to, and what I want you to early on recognize is that the authors are making a distinction between syndemics as opposed to comorbidities. So for instance, repeatedly in this paper, the authors talk about diabetes kind of being a underlying sort of factor, along with social factors, which made the condition a lot more complex. So during the pandemic, we saw this. For instance, the COVID-19 pandemic, number one, there was a lot of other things going on that complicated matters, social factors. So the importance of local socio-environmental conditions, demographics, and disease configurations, these were important in the varying conditions to create local syndemic expressions. But then also the ways that the pandemic has exposed the weaknesses in global healthcare investment, and how the syndemic nature reveals the rising rate of non-communicable diseases and their potential interaction. So the main point here, and it's within here, it's kind of buried within the paper about understanding, pre-existing conditions such as obesity, diabetes, severe asthma, respiratory, cardiovascular, non-communicable diseases, how to best study these, as a comorbidity, potentially, but from a medical anthropology perspective, just thinking about rooted in the cross-societal orientation, thinking of the syndemic approach. And so this is rooted in medical anthropology. And this was when they were talking about the global health pandemic of HIV. And so something known as SAVA, the first syndemic, involved adverse interaction of substance abuse, violence, and AIDS. So that factors shaped by context, including poverty, discrimination, and blocked social advancement. So that was the first kind of syndemic sort of designation. But then anthropology goes into kind of capturing some of these. And if you think of composite indices, and for instance, social deprivation index or something like that, these are kind of having similar function, but this is kind of sometimes using a disease framework. And also my discussion on polygenic risk scores, that was using genes, of course, but also multifactorial. So the common theme here is using multifactorial frameworks. So within this framework, syndemics seek to enhance understanding of the fundamental biosocial nature of health, and the ways that disease and other health-related conditions interact synergistically in consequential and often deleterious ways. So there's kind of a flow of multiple biological and psychosocial channels and mechanisms. It's biochemical changes in the immune system, damage to organs, weakening of cellular repair processes, disruption of the inter-organ communication network, and psychopathological effects on behavior. So it's a whole host of different breakdowns and interaction that leads to the disease process. And so with COVID-19, we of course knew that it was because of the virus's affinity for the ACE2 receptors within the body. But it emphasizes how the social conditions interact with the disease processes, contagion, and environmental factors, structural, political, economic. So there's a lot of important portions to this, but this also was looking at, for instance, with HIV, when it became leading cause of mortality worldwide, because of its syndemic interaction with an array of diseases. This included non-infectious diseases as well. For instance, diabetes, kidney disease, cancer, food insufficiency, and cardiovascular diseases. Among infectious diseases, hepatitis, tuberculosis, malaria, and other sexually transmitted infections. So as you can see, HIV was one of those that was could have been considered a syndemic sort of, and was. There was also concerns with COVID with similar sorts of effect. SARS kind of saw diffuse sort of damage as well. So just I would encourage you to also look into the biosocial interaction, and then look into the social determinants and structural violence of the COVID-19 syndemic. This is an important point to look at as well, because it's looking at. So what is key here is to really point out and understand how social determinants are being typified here. So within the United States, social and health disparities are significantly shaped by both poverty and structural racism, which refers to the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice. So there's high rates of poverty in historically marginalized populations, and of course comparative analysis of black and white neighborhoods definitely demonstrate these inequality gaps. But geospatially, if we were to take a look, similar patterns would exist as well. So this broad association between race and health actually also holds true when socioeconomic status is controlled, because a lot of people will just say that is explained away with socioeconomic status, but that's not the case. And that's by Phelan and Link, page 320. So there's infrastructural factors such as poor access to quality medical care, minimal availability of nutritious food, exposure to environmental toxins, unsafe neighborhoods, and residential segregation by race ethnicity, which is an underappreciated driver of inequality in the U.S. So this goes talks about the marginalization and how talking about they proposed the notion of infrastructural violence to bring attention to the material ways in which social structures of inequity and discrimination cause recurring harm. So that harm is stated as violence. So this is kind of high levels of social stress, but the perspective of anthropology is from the perspective of violence. And how vulnerable cultural populations and cultural groups experience this in different ways. And so these cultural groups might be by city, by neighborhoods. So there's different ways, and geospatial analysis allows for this unique type of analysis to take place. And of course, lowest levels of educational attainment had high rates of hospitalization and deaths related to COVID-19. And of course, I did some really important work in educational attainment and geospatial analysis, which is right now being considered in a journal. And this was in collaboration with others. And looking at what epidemiologist Kamara Phyllis Jones says, putting it bluntly, racism puts you at a higher risk of COVID-19. People of color are more infected because we are more exposed and less protected. Then once infected, we are more likely to die because we carry a greater burden of chronic diseases from living in disinvested communities. These conditions of vulnerabilities include poor access to quality health care, working in frontline, low-wage, essential jobs, reliance on public transportation, challenges in following preventive measures. And these vulnerabilities among immigrants, among homeless people, among individuals, marginalized populations, continue. And so there's really a greater need to understand all of this from all different disciplines and understand how social determinants of health come together sometimes to create conditions which are similar to syndemics. In this argument, in this form, I wanted to point out something that is important to note is that increases in respiratory risks are directly tied to structural factors and the corporate release of industrial toxins. So the argument is that toxic pollution is a form of violence. So all of these things are really combining to create conditions of structural violence, and then this leads to more poor health outcomes. It's from the same mechanisms that I have described in other places, with the increase in glucocorticoids and stress receptors and everything else. So there's actually a lot of weaknesses in global health investment that needs to be addressed, and some of the Sustainable Development Goals help to identify some of the weaknesses. But during the COVID-19 pandemic, this was really noticed, some of the weaknesses. So really understanding the social inequities, even in anthropology, is one of the major priorities, and understanding how social and health policies specifically affect urban slums and shanty towns where poverty, broken families, and a high risk of violence are also the settings where depression, suicide, post-traumatic stress disorder, and drug misuse cluster are the highest. So these are the main focus for the anthropological perspective of social determinants of health. Thank you for listening.